We think of our skin as this incredible fortress, our first line of defense against, well, everything. But what happens when that defense is breached? It turns out a single, really common bacterium can send the body down two totally different paths. One is a serious infection, for sure, but the other is a complete catastrophe. Today, we're going to get into how exactly that happens.
Think about it. We've all gotten a scrape, a little cut, maybe an insect bite, and 99% of the time, it's nothing to worry about. So how can something so simple, so mundane, suddenly spiral into a true life or death situation? That's really the question at the heart of what we're talking about today.
Okay, so it all starts with this one big clinical term, dermohypodermitis. I know, it sounds super complex, but all it really means is a bacterial infection that's gotten past the surface and is now in the deep layers of your skin, the dermis, and the fatty tissue just below it. Let's just think of this as the family name for the two very different conditions we're about to meet.
And the main culprit in this whole drama is a bacterium you've definitely heard of, Streptococcus pyogenes. You probably know it as Group A strep. Yep, the same bug that causes strep throat. But when this guy gets into your body through a break in the skin, it can write a completely different, and sometimes terrifying story.
So this is where our story splits in two. Once that bacteria is inside, it can head down two very distinct paths. One is a serious infection, but it's manageable. The other is a full-blown catastrophic medical emergency. And this really lays out the stakes perfectly. On one side, you've got erysipelas, a serious skin infection, yeah, but one that usually responds well to antibiotics. But on the other side, you have necrotizing fasciitis, a life-threatening emergency that just destroys tissue and frankly has a really high mortality rate. Same bacteria, but wildly different outcomes. All right, let's start with that first, more common path. This is erysipelas. You can think of this as a big, flashing red alert from your body, a serious warning that you absolutely need to pay attention to. So when erysipelas shows up on the face, there's this really vivid description for it, a red plaque in a butterfly pattern. It's this very distinctive visual that gives doctors a huge clue about what's going on. And it's not just a simple rash. No, we're talking a sudden, high fever, like 39 to 40 degrees Celsius, that comes with chills. That red area or plaque is swollen, hot to the touch, and painful, and it has this very clear, raised border. And here's a fascinating little clue for diagnosis. It almost always spreads across the face, but leaves the chin alone. Now, let's look at the other place it loves to show up, a limb, usually the leg. The description here is a little less poetic, but just as clear. It's often just called a big, red, hot, swollen leg.
But here's a key difference. Unlike those really sharp, defined borders you see on the face, the redness on a leg is often more spread out, with fuzzier edges. The skin itself can get really tense and almost look shiny. That's your body's inflammatory response just going into complete overdrive.
Okay, let's take a deep breath and talk about the other path, the rare, devastating one. This isn't just a red alert anymore. This is a code black situation. We're talking about necrotizing fasciitis. This is the real name for what the headlines call flesh-eating bacteria. And it's important to remember, it's not some different exotic germ. It's our same friend, Streptococcus pyogenes, but it's on an absolutely terrifying, destructive rampage, and it is rapidly destroying the deep tissues of the body. If you remember one single thing from this entire explainer that separates these two infections, make it this. The defining feature is an exquisite, localized pain whose intensity increases with time. The pain is completely, utterly out of proportion to what you see on the skin. It's the loudest possible alarm bell your body can ring. And the speed of this thing is just breathtakingly fast. I mean, look at this. In just 24 to 48 hours, what might have started as a simple red rash can darken to violet and then black, often with blisters popping up. From there, it moves into the final stage, gangrene, and that's the literal death and decay of tissue. The stakes just couldn't be higher. This is not something that gets better on its own. Even with the absolute best, most aggressive modern medical treatment we have, the mortality rate for necrotizing fasciitis is a staggering 30 to 50%. So how in the world do you fight something this aggressive? Well, you don't wait. You don't hesitate for a second.
This is an absolute race against the clock, and it requires an immediate, all hands on deck attack.
The protocol is crystal clear and incredibly urgent. First, immediate admission to the ICU. Second, a powerful combination of 2 different antibiotics is pumped in through an IV. And third, and this is just as vital, emergency surgery to physically go in and cut away all of the dead and dying tissue. And yes, this can, and often does, mean amputation to save a person's life.
And this is a hugely important public health warning, one we have to emphasize. Common over-the-counter anti-inflammatory drugs, we're talking about things like ibuprofen, must be avoided. Why? Because they can actually mask how severe the pain and inflammation really are, which can delay the diagnosis and potentially make the outcome of these serious infections so much worse.
So, we've seen the 2 completely different roads this one little bacterium can take. Let's try to boil this all down now to the most essential warning signs, the key takeaways that can help tell the difference between a serious warning and a 5-alarm emergency. Okay, this table really sums up the critical differences. Let's just walk through it. First up, pain. This is the big one. With erysipelas, yeah, it's painful, but it makes sense for what it looks like. With fasciitis, the pain is excruciating, just way out of proportion. Next, the skin. Erysipelas is bright red and hot. Fasciitis rapidly turns dark, purple, even black, and it blisters. Then there's the speed. Erysipelas spreads over days. Fasciitis can spread in just hours. And finally, the systemic effects. Erysipelas gives you a high fever and chills, but fasciitis can lead to toxic shock, which is a body-wide collapse.
So at the end of the day, the most crucial point is to just trust your body. Rapid changes to your skin, severe pain that feels completely wrong, and just that general sense of being profoundly unwell, that is never a wait-and-see situation. That requires immediate, urgent medical attention.
It's really just a stark reminder of how a tiny, microscopic battle happening just under our skin can escalate with terrifying speed. And it leaves us with a really important question to think about. What does this tale of 2 infections teach us about how incredibly important it is to listen to our body's loudest, most urgent alarms?